Hi everyone. So today, thank you for joining me today. So today we are going to talk about something that I say almost every single day in the clinic, which is shoulder pain. Okay, so let's start. So before we start, I want to ask you a quick question. Have you ever felt pain when lifting up your arm, or like stiffness when I'm reaching behind your back, or maybe your shoulder just feel tight all the time and it's hard to relax? If that sounds familiar, you are definitely not alone. Actually, shoulder pain is one of the most common problems nowadays, especially with our modern lifestyle, always watching the computer and the phone, things like that. A lot of office job. So first, I'm going to talk why shoulder pain is so common. Let's talk about, so shoulder problem were more common in people doing heavy physical work. That's in the past, and most of people think, oh, that's how it works, like construction workers or athletes. But now it's more common among office workers, students, even teenagers. They are all experiencing shoulder pain. Have you ever wondered why? So the main reason is posture and lifestyle. So we spend so much time looking at our phones, working on laptops, sitting for long hours. So when we sit like this, shoulder forward, hand down, and your shoulder muscle are constantly under tension. Even if you don't feel pain immediately, over time, this will build up. So the body is not designed, our body is not designed to stay still for hours. We need bit movement. But with that long office hours job, it's hard. I understand it's hard because our body is designed to move. That's we call it yang energy. That's where all yang energy comes from. So it's a movement, not a stillness. Let's talk about it from medication way. So from a Western medicine perspective, I'll keep it simple, but I want you to really understand what's happening inside your body. The shoulder joint is actually one of the most mobile joints in the body. That means you can move your arm in many directions. It's like we call it abduction, flexion, extension. So in all different directions, which means it's quite flexible. That's the benefits of our shoulder. It allows you to do a lot of different daily activities, but at the same time, it also means it's less stable, because if it's too stable, you can't move too much. So, excuse me. So it's easier to get injured than other body joints. And the first cause is muscle tension or strain. So this is probably the most common reason. So when muscles like your trapezius or rotator cuff are overused or overloaded, lifting heavy things, they become tight and painful. This usually happens due to poor posture, like what I said before, and also repeating movement. You are always doing the same movement all the time. Like when you're holding the mouse in front of the computer, you're constantly doing that. And also, the last but not least, stress. We all feel so much stressed in modern lifestyle. So the stress actually make the shoulder muscle tighter. Stress makes every muscle in our body tighten. The second reason will be inflammation. So sometimes the problem is inflammation that includes tendinitis, bursitis. So those are medical words which describe the inflammation around the muscle here. And the symptoms you could say like pain when moving, and tenderness when palpate, when press it down, sometimes even swelling. So you have a look at your shoulder to see if you can see swelling or tenderness that might indicate muscle inflammation. The third one is called a frozen shoulder. I'm sure a lot of people have heard about that. So it's that means adhesive capsulitis. So it's a way we call it frozen shoulder. You say frozen, that means you can't move it. It's frozen. That's because all the muscles are stick together. After a long time, repeating movement or injury, they are just stick together. And you can't even move it. And this one, I want to talk a bit more because this one is quite common in people, in my patients. So this condition normally has 3 stages. The first one is painful stage. So you sort of start to feel pain increased. And especially at night, most of my patients, they feel the pain worse at night than daytime. So that's the first stage. And that is still the early stage of the frozen shoulder. Okay, the stage 2 will be frozen stage. So that is when the movement becomes very limited. So you can't lift your arm, you can't reach behind your back. I mean, you can, but it's very painful and you feel like it's pulling. The muscle here is pulling, or it's quite painful and you don't want to do it. You literally just, people say you like this, you can't move your shoulder properly. And the third stage is the recovery stage. So this part actually, it's recovery stage. So the movement slowly improves over time. But this stage is very, very slow. Okay, so the key point I want to talk about today is if you treat it early, recovery is much easier. Like say if you treat it in the early stage, painful stage, you'll be able to recover it very fast. But if you ignore it, it can take a very, very long time. Okay, now I'm going to talk about in TCM way. So in TCM, there things get like this is where things get really interesting. So the core concept in TCM, we say if there's no flow and there's pain, but if there's flow, there will be no pain. So now you know when you have pain there, so that means no flow. What's no flow? So it's the energy. We call it qi and blood. They are stuck there. They are not flowing smoothly. That's where all the pain comes from. And we have different patterns for TCM. The first one will be qi. We call it qi and blood stagnation. That's the most common pattern. So when, like what I said before, when qi and blood are not floating properly, so you got pain. And in this symptom, you might get fixed pain. So the pain, you can pinpoint where it is. It's right there or right there. And you also feel the pain quite sharp. That means there's blood status underneath. It can't move by itself. And also when you press it, you feel worse. So you feel worse with pressure. That's called qi and blood stagnation. I'll repeat 3 symptoms. The first one, fixed pain, sharp pain, and worse with pressure. So that's when we call qi and blood stagnation. And the second pattern will be cold dam invasion. So that's when you expose yourself in a very cold environment, or in summer, but you are in the office where all the cold conditioner is running. So you get cold invade in your body. So the symptoms could include heavy, aching pain, and very stiff, and worse in cold or in humid weather, like raining day, damp day. So do you have you ever noticed that your shoulder feels worse when it's cold or when it's raining? I'm sure a lot of people will feel that way. So that's indicates that there's something cold or dampness invade your shoulder and you cannot get it out from your shoulder, and eventually you get pain from that. Okay, the third thing is liver and kidney deficiency. So this is more for chronic conditions, because when like for older people, they are weaker than young people, and when their body is weaker and weaker, the recovery usually takes very long time, and the movement becomes more limited. Like when we say weaker, it's I refer that when we become over 40, and we can't stay young forever, and we can't stay strong forever. Over 40, so our body functions is getting down a little bit down gradually. So eventually we are deficiency from kidney and liver. And then we don't have enough energy here as well. So over time, you got shoulder pain. But in TCM, so we are not just looking at the local muscle or joint. We are looking at the whole body balance. So it's not just treating the shoulder. We look at if you are qi and blood stagnation, we help move the qi and blood. We can do this by using needles or using herbs. And if it's cold dam invasion, and we use like moxa and cupping and heat lamp, all the heat methods to help you to get away with the cold and dampness. And if your pattern is liver and kidney deficiency, which means chronic condition, and we can also use herbs to help you tonify your kidney and liver. Once your organ function better, the pain will get away. And there are also some people who feels like I want to massage it, but the massage sometimes it doesn't get better, it actually get tighter. So because in massage you can actually irritate the muscle and cause more inflammation. So the body reacts by tightening the muscle to protect itself. That's why massage doesn't always make you feel better. And in TCM, you are only treating, so by massage, you are only treating the surface skin. You are not treating the root problem. Because if there's qi stagnation or cold dam inside, massage is definitely not enough. It's only the surface area. Okay, so now let's talk about the treatment here. So in acupuncture, this could be one of the most effective treatments. We use local points, like we call it large intestine 15 or 三焦 40. So that's 2 points located both sides of the acromia joint, and we put needles there to help to release the muscles underneath. And we also use some distal point because the channels are all connected. So the channels on the shoulder could be connected to the knee or to the lower leg. So we use needles. To insert needles around the other area and ask you to move your shoulder and make you feel better. A lot of patients feel immediate relief after doing that. We can also use cupping or guasha. So the cupping actually is a very, very good way to release muscle tension and improve local circulation. So I'm sure you have heard of that. A lot of patients, they enjoy that. After cupping, they feel much better for all the musculoskeletal pain. We also provide herb in our clinic. So if you are cold, we warm you. And if you blockage or stagnation there, we help to move. And if you are deficiency, we help to tonify. And there are some simple exercise for you as well. So you can slowly lift your arm and stop it when you feel pain and hold for 5 seconds and relax. You can repeat that as much as you can. But if it's too painful to do that, please stop doing that. And please, come in. Yes? Yes.
Are you still doing it?
Yes. Yeah. Almost finished. Yes.
We have a patient for free quick acupuncture.
Okay, so 5 to 10 minutes. Is that okay?
Yeah.
Cool. Sorry, I just got a patient waiting for me here. Yeah. So if you experience severe night pain and cannot lift your arm at all, or you feel numbness or tingling on your hand, please do find the doctor or find us and see what we can do for you. So in our clinic, we can help assess your condition properly, and we can identify the root cause, and we can use acupuncture to reduce pain, improve your movement gradually, step by step. And I found many patients notice the improvement after just a few sessions. Okay, so that's my main points today. Shoulder pain is very common, but it's not something you should ignore. The earlier you treat it, the easier it is to recover. Thank you for listening, and take care of your posture and take care of your shoulders. Thank you.